I know, and you know, that most people have this idea that yoga is a good stretch. And if I'm not flexible, I can't do yoga.
Absolutely.
No, there's no way. There's
I
no
get
way.
that all the time. I can't do yoga. I'm not flexible.
Right, so don't do it. So, but yoga is much more than flexibility. And the help it can provide is far beyond a good stretch.
That would be a benefit, by the way, flexibility.
That is one of those benefits, yeah.
Yes.
For me, in the world that I work in with cancer patients and survivors, the list of side effects from their treatment is long. And the list of benefits that yoga, there is research evidence to show that some of these side effects have been researched and directly affect and can not only help, in some cases it reverses and heals. But so I say, how does yoga help? Well, let's look at the research evidence. And for me, it's really important to point out that in the last 2 decades ago, there might have been 10, maybe 100 research studies that had been on applying yoga to cancer patients and survivors and all of the multiple side effects that they have. 10 years later, there's hundreds, and which is wonderful because now we have evidence, research evidence backed by NIH and other big organizations that say this side effect, this challenge that a cancer patient is having, such as neuropathy, range of motion, and maybe a few that people are not aware of. Hair loss is no big deal, but bone loss is a huge big deal, lifelong. Your hair will go back. But that's what we think most of when we hear about the side effects that a cancer patient is going to have. So anyway, the research shows, not only for cancer patients, for the population in general, the huge benefits. I mean, we're really fortunate to have all this evidence now, which we didn't years ago. And so I boil it down to much more the understanding of the physiological things that are happening in the body. The mental, emotional things are wonderful. But yeah, standing on one leg does build bone, and you can build bone back. So it's not a matter of it being lost, but it has been compromised. Let's work with that. So in my world, that's how yoga works.
Well, let's talk about standing on one leg.
Right. What are the other benefits of that?
I work often with amputees, so people who have lost limbs. And often you would think, or many people who have lost a limb think that they can't do yoga or they can't come into this practice because they only have one limb. And I will tell you that most of the time my amputees have the best balance that any two-legged person has ever had.
Right.
So from a physiological standpoint, bringing back in balance and strength and stability into the practice, they have to rebuild that, and especially with balance with only one limb. On the other side of that, we're also dealing with a lot of phantom pain that they feel from not having that limb, that we're having to kind of rebuild the nervous system. We obviously do that with breath work. And working with paralyzation. And many people think, I'm paralyzed. I can't, what can I possibly get out of a yoga practice? I can't move.
Right. I can't move. I can't stand on one leg. I can't. And being yoga teachers for the populations that are challenged, we have to be a little bit more clever. We have to learn how to use props and use things in order to build this confidence, because some of your one-legged clients can stand better than probably I can. I work on my balance all the time because I think it's something we naturally lose. Like getting older, we naturally lose bone density. Um, and that we can use the mindfulness focus of a practice, and also all these incredible props. I'm sure you use
We use props all the
all the
time.
time.
Yeah, definitely use props. And you're right about creativity. You have to, what works for one might not work for the other, and actually how it feels. And I know, like, sometimes working, just even a side stretch, someone might be able to get their arm over the head, and the other person to get that same stretch might just be extended out with assistance. You, sometimes you're working with physical assistance and sometimes you're not, but it's working to the same end, right?
And that sort of is the point too, is, what is the purpose of any particular yoga pose that we ask someone to do? I mean, to do it just, because it's a pose that I like to do and I like in my body, is not necessarily healing and helpful. But when you've been experienced with those who have been challenged, and you can look and see, she's lost total range of motion. What can I do? What can yoga do to help bring that range of motion back? So you kind of construct the yoga practice with a little different purpose than, you know,
I really like when you pick up range of motion, because with the population that I work with, range of motion can really be an issue or a problem, if you will. And whether it be a shoulder or a hip or a knee, whether it be paralyzation or not, many of the men and women that come into my classes are definitely working with range of motion, which again is leading to chronic pain and frustration because they don't understand like why their body isn't moving, like it's not where they
Right.
want to be.
right,
They want to be in the old body.
right.
So that's like a point of contention with them.
Yeah.
And it's getting them in the present moment, getting them grounded right here and now, and really with no attachment and no judgment to what is here.
Right.
Which helps them mentally to be okay with what is,
Really good point.
which
Yeah.
is part of the practice,
Right,
right? To
absolutely.
be mindful and to be present.
Yeah. But then also the practice giving them ways to be their agent to deal with. I mean, I have so many, it's lots of breast cancer survivors, and this is a condition that is not just particular to them, but it's one that is, it's lymphedema, which is very, very, breast cancer survivors experience it a lot. Maybe 40% of them do. It's experienced in other kinds of cancer surgeries, but it's a very debilitating, lifelong. I mean, once you get it, it's like there's no cure for it. But again, it's the research that has shown that what we do in yoga, the weight bearing that we do in yoga, I mean, they've researched it and shown those with lymphedema, those who did yoga, those who did not, and it will begin to reverse that condition, which is very debilitating in a lot of cancer survivors. So, that's really heartening way that yoga literally helps.
I think so many things that we can do in the practice can help. And I think once they start feeling good physically in their body, that things start changing in their minds.